I would like to follow up on this speech just made on the floor by my colleague from South Dakota, because his observations about shortages when it comes to health care across America affect not just his state of South Dakota, but certainly affect Illinois and many other states as well. We are in desperate need of additional doctors and nurses and dentists and medical professionals. We're in need of more technology. Telehealth, of course, is one of those technologies, to make sure that we expand the reach of medical care in the United States. In the midst of this coronavirus pandemic, we understand that now more than ever. That's why I've introduced legislation called the Health Care Heroes Act of 2020, with specific design to dramatically expand the number of healthcare professionals. There is one way to reach that goal, I believe, and that is to incentivize medical students, dental students in America to make a commitment to serve in areas of greatest need in this country for at least 2 years and to remain in a reserve if needed for a medical emergency. And what would they receive in return? Forgiveness of the cost of their medical education. Do you know that most doctors and dentists who graduate have a minimum of $240,000 in additional student debt over and above the undergraduate experience, $240,000 in debt when they become licensed doctors and dentists, some even more? And imagine if those young men and women with all this talent and all this determination want to serve in the areas of greatest need, but throw up their hands and say, I have to pay off this loan, I have no choice but to go to a different place. If we had the National Health Service Corps expanded to provide loans for the cost of medical education, with the incentive that those new professionals, medical professionals, would serve in areas of great need, it would certainly help to solve a major problem in America. We feel it in the inner cities, but we feel it even as intensely, if not more so, in the rural and small town areas of the senator from South Dakota and my state of Illinois. Could we work together to do this? To come up with the money to make sure these medical professionals are there? And don't overlook, when we talk of doctors and nurses, about the need for dentists. There are millions of people in my great state of Illinois who do not have ready access to dental care. The Illinois Dental Society, once or twice each year, has a free dental service weekend. And they, usually on a Saturday, will allow any patient to come in and have dental care given to them for nothing. People wait in a queue in a line overnight for this opportunity. Can you imagine having a problem with your teeth, some pain or discomfort or perhaps a disfigurement, and being unable to afford the care that you need? For many of these people, this is their last chance to wait in line all night to get in for free dental services from the Illinois Dental Society. I've seen it. It's remarkable, and my hat's off to the Dental Society and the dentists who provide these services. But what an eye-opener to see all of these people who are in desperate need of dental care. We need more dentists. We need to make certain that they are accessible and affordable for Americans wherever they may live. So I support the suggestion of the senator from South Dakota when it comes to telehealth, but let's make sure we have the men and women on the front end of the process who are still an important and critical and essential part of the kind of professional medical service and dental service that we all need.